Welcome back. Well, the acting director of Africa CDC, Dr. Ahmed Ogwell, says the health security situation in Africa is still fragile as the continent deals with multiple disease outbreaks. He noted that Africa CDC is working closely with Uganda authorities to contain an Ebola outbreak reported in the country. The Minister of Health, in conjunction with the Busia County government, have intensified surveillance at the border town with thorough scrutiny of travelers and truck drivers along the Kenya-Uganda border.
Speaking during the weekly update on disease outbreaks on the continent, the acting director of Africa CDC, Dr. Ahmed Ogwell, called on member states to scale up vaccination efforts to help reduce the disease burden on the continent. He noted that of the 8 deaths reported at the epicenter of the Ebola outbreak in Uganda, only 1 death was confirmed to be Ebola-related. Further adding that 10 suspected cases of Ebola are under investigation, with 43 contacts being monitored to ensure it does not spread.
A total of 10 suspected cases are currently under investigation, and 43 contacts have been listed and are currently being monitored so that we ensure that it does not spread beyond this particular area of Uganda. In a situation like this, you want to be able to include in your planning all the immediate neighboring countries because travel these days is very easy.
The acting director noted that Africa CDC has sufficient stockpiles of vaccines ready to deploy once the situation calls for such a move. He explained that various strains of Ebola have different hosts, hence allayed the fear that it could have been as a result of consuming bushmeat.
The Sudan strain does not have approved vaccine. So in that way, protecting the community where the outbreak is and protecting our health workers becomes more challenging in the absence of an approved the vaccine.
The Kenya government, in conjunction with Busia County government, have intensified surveillance and embarked on thorough scrutiny of travelers and truck drivers along the Kenya-Uganda border.
Tuko na port health, Busia border na Malaba border. So those staff are already screening travelers hapo kwao in terms of just looking at the signs of anybody who could be having signs of Ebola viral disease. But tunataka kulias na Ministry of Interior ili ya kwamba watu wote waweze kuingia Kenya through the official route, kwa sababu hapo ndio tuko na screening inaendelea.
There is even as yet another death, a 1-year-old child suspected to have succumbed from Ebola-like symptoms was reported by Uganda's health ministry officials. Opicho Chemtai for Prime Edition.